company was founded with the premise that practices need to increase their practice efficiency using automated patient communications. And we use text messaging, email, and recorded voice to help them do that. And especially around appointments. Make sure they show up to their appointments, get feedback from them after their appointments, and even call those who don't have an appointment but we want them to be in the practice. Well, the number one complaint that patients have about waiting in a practice is precisely the time in the waiting room. It's actually a peer research finding, and it was all around the country. They always complain of not knowing how much time they're going to have to be in there. And the number two complaint that this research found was that they hate to wait on the phone. A lot of systems have phone trees and they give them a lot of options and then they make them wait. And that's clearly something that the patients aren't happy about. So we're trying to help them alleviate some of those pains for the patients and help them automate some of the patient communication process so that the phone lines are more clear, and also so that patients don't have to wait that long, or at least that they're informed when they have to wait or how long they have to wait. It's kind of like the airline system of notifications. Whenever your flight's delayed, you're happy to know at least how long you're going to have to wait, even if you can't do anything about it, but at least you know how long. It's the same thing for patients waiting. You know, if you're informed when you're waiting, that makes it a lot easier. One of the most important tips I give medical practices to avoid having patients wait for too long in the practice is to make sure that they notify them about their appointment with enough time, and then if there is a doctor running late, they let them know. It's as simple as sending them a text message saying your doctor is running late by an hour. Of course, there are systems that can help you do that automatically by pulling that information from the database, or having someone just make a few clicks and send those messages. But you could do it as simple as having someone in the staff sending text messages. I've seen practices do that, and it's not the most efficient way, but at least it's a way to have the patient be informed about the wait they're going to have to do, and that definitely increases patient satisfaction. We've seen patients really happy about saying, you know what, I knew I had to wait, but at least I could go and get some coffee. At least I knew I could come back in an hour. And again, it's about increasing patient satisfaction in this case. Another tip that I would give for medical practices who want to increase their practice efficiency is to manage their incoming calls. One pew research found that waiting on the phone is a big complaint from patients. So if you can actually recognize the patient when they call, they will like it. It's kind of like those hotels when you call and they say, "Hi, hello, Mr. Diaz, thanks, what do you need?" You can do that for patients too. You have the information in the practice management system. You have their numbers. So if they're calling, you can customize the message and you can say, "Hey, I see you calling, you have an appointment tomorrow. Are you calling to confirm? Or would you like to schedule? Or would you like to refill a prescription?" And instead of having to go through a phone tree and waiting on that increases practice efficiency, but it also increases patient satisfaction as well, which is one of the major things we worry about at Vital Interaction. Well, one of the main characteristics of an automated patient communication system is that it connects to the EMR or to the practice management system in the background, so that the staff doesn't have to enter information twice. So the system is able to grab the information of the schedule automatically, remind patients they have an appointment, and it does it automatically using text messaging, email, or recorded voice, and it notifies the staff if somebody wants to reschedule or wants to cancel their appointment. But for those who already got the confirmation, it's a simple report that will let them know that all of these patients have already been confirmed, and it saves the staff a lot of hours. And the staff that has to make those phone calls, they love when they are able to implement an automated system because it simply makes their lives easier. In our experience, we have been able to reduce the no-show rate by up to 30% in some cases. And it really depends on the practice, the patient population, their adoption on text messaging. because text messaging is the most effective tool that we've used to reduce no-shows. And you know what, when you think about it, it's logical. Most practices who are doing reminder calls are doing reminder calls to the home numbers. Ironically, they do it during the office hours, so people aren't there at home. And then they may receive the voicemail, they may hear it, but maybe it's too late and they can't tell the practice that they won't be able to come. But if you're able to let them know via text message, even if they're in a meeting, they can reply and say, yes, I'm coming. Or if they're not coming, you can reschedule them and cancel that appointment and get someone else in. And that reduces your no-show, because it's somebody that may have not shown at the appointment the next day, but if you know, it's no longer a no-show. You already used that appointment. So as I said, it does have the potential of reducing the no-show up to 30%. It really will vary depending on the practice and what their current no-show rate is. Some practices have as bad as no-show rate as 20%. Some practices are really good and have a 5% no-show rate. But even then, reducing that no-show by a little bit, if it's a high volume practice, represents a lot of money. Texting is a major trend everywhere. As a matter of fact, the largest population adopting text messaging right now is a population between 55 and 70, which is surprising, right? Obviously, teenagers adopted this before anyone else, so that's why it's not the largest population adopting this. But when you think about it, a lot of the grandpas or baby boomers, not just grandpas, but even baby boomers have started using this technology earlier, and they use it to communicate with their children, their grandchildren, and it's becoming a really, really effective way for them to communicate. Some people say you can't reach teenagers if it's not in a text message, so kind of like they have had to get used to that trend. Now, one important thing to say about text messaging is that it's not secure, in order to make sure you stay HIPAA compliant with text messaging, the major or the most important rule is to not send any protected health information. In our case, we use text messaging mostly for operational things, reminding they have appointments, getting them to come back to the office. But it's a very general message that doesn't mention any condition or anything that can be considered protected health information. And that's a very important caveat to make whenever we talk about text messaging in healthcare.